2014. I wanted to talk to you a little bit about food allergies because I know that food allergy parents are often seen as helicopter parents, a big pain in the, well, you know what. But food allergies are something that we did not choose. We're part of a club we don't want to be in. We wouldn't want members like ourselves. Food allergies are not a lifestyle choice. They're not something to lose weight or to get healthy, and they're not a result of fussy eaters. Food allergy, and this is the key to awareness, is a life-threatening condition. It's a condition where a child can react in a matter of seconds to minute amounts of a substance. And this often leaves parents feeling quite concerned, to say the least, and quite nervous. It has huge impacts on a family. We are the ones who cannot leave our children at an event. We are the ones who, before every single event, be it a birthday party, a family gathering, a restaurant, going, to the local takeaway, we have to check everything, talk to people, make sure ingredients are clean, make sure there's no cross-contamination. It's a huge pain, and it is definitely not something that I would wish on anyone else or that I would personally choose. I am a person without food allergies. If I hadn't witnessed firsthand a perfectly normal child just breaking out in hives, screaming, swelling, and crying uncontrollably, like within minutes, I would have never believed that such a thing was possible. Food allergy awareness is not just for families with food allergy. It's particularly for people without food allergy, because if you are a parent or if you have relatives or friends with children, the chance is, particularly if you're a teacher, the chance of you coming across a child with food allergy in the Western world in 2014 is quite high. The prediction is for 1 in 10 Australian children to develop a food allergy and for 1 in 13 US children to develop a food allergy. So now we're talking nearly 2 children in every single classroom. What can you do about this? How can you help? First of all, realize that it's serious. It's not just a kid, I don't want to eat this. You can't freaking eat it. You'll be in the hospital. You could stop breathing. You could die. It's serious. So that's number 1. Number 2 is realizing that certain foods, such as peanuts, are the big one. They put out dust. I was at a party recently with peanuts, and when I took some, I realized, my God, there is no way to keep this thing contained, because the second you touch it, the dust was on everything. It was on the drink. It was on the water that you were pouring. It was on every other dish that people were reaching for. So there's, certain foods that are much more difficult to contain than others. Also, be aware of cross-contamination. Is the cutting board you're using clean? Has the knife or spoon you're using gone into something that the child might be allergic to? And has the food that you're serving been made in a factory that has the child's allergen or made on equipment with that allergen? You need to be careful to read not just the ingredient label, but the allergy warning label too. The last thing is to be aware of the symptoms of severe allergic reactions. The worst symptoms are, apart from stopping breathing, which is a clear one, but swelling of the face, the tongue, the neck, difficulty breathing, hives all over the body. Learn more about the symptoms so that you can recognize them and take action. And the action you need to take is to administer epinephrine, which is also called adrenaline. Most children are carrying an EpiPen if they have diagnosed food allergies. If you have a child with food allergy, you should actually ask, where is their EpiPen, so that you have it handy. And if you administer an EpiPen, remember to call emergency. The child needs to be monitored. So thank you for listening to this video. Happy Food Allergy Awareness Week 2014. Let's not be afraid, let's be aware, and let's work as a community to keep children safe. If you'd like to learn more about what you can do to help diminish the odds of having a severe allergic reaction, subscribe to my channel, and I'll be talking more about this in upcoming videos. Thank you.